Tonight we're going to talk about the 3 goat diseases that have been chosen. AgFutures, the goat fibre, have requested me to talk on these 3 diseases. Polioencephalomalacia, which is sometimes called cerebral corticonecrosis, or polio for short, coccidiosis and goitre, either due to iodine deficiency or milk goitre. So type in your questions when you think about them. The predisposing causes of polioencephalomalacia are firstly high-grain diets. High-grain diets predispose the rumen bacteria into producing thiaminase, which destroys the thiamine as soon as it's produced in the rumen, which is what normal goats do. It can also occur in high sulphur diets, for example, those high in molasses. Mouldy feed is a predisposing cause, as is coccidiosis or scouring. Some veterinary drugs, such as amprolium, levamisole and thibendazole. Some poisonous plants, such as bracken, as shown here, nardoo or rock or mulga ferns, and lead poisoning or salt poisoning, which happens generally when there's no water available for the goats, can also cause polioencephalomalacia. So these are the plants to look out for. This first one here on the left is rock or mulga fern. Green fat hen is high in sulphur, and that has caused problems in sheep. And nardoo fern is the photo on the far right, and it's a very tiny plant. The clinical signs of polioencephalomalacia are stargazing, being unsteady on their feet, blindness, but the goat still has a pupillary light reflex, head pressing, which is where a goat presses up against the wall of a shed or fence post, nystagmus, and we'll have a look at nystagmus in a minute. There's no elevated temperature unless they start convulsing. And this is a good way to tell the difference between listeriosis and polioencephalomalacia, because they have similar nervous signs. And eventually the goat will go into convulsions and die. So this is what nystagmus looks like, and this you can look at on my YouTube channel, Goat Fed Oz. And so let's have a look at this. This was a case of polioencephalomalacia, which was due to mouldy feed. This video shows nystagmus, where the eye goes slowly backwards and forwards. It's a nervous sign, and the most common cause is polioencephalomalacia, or polio, which is caused via vitamin B1 or thiamine deficiency. So you can confirm with laboratory tests that can find increased thiaminase in the rumen or faeces, high sugar levels or glucose in the urine. But be careful, because enterotoxemia can also cause glucose in the urine. On postmortem, there's low thiamine levels in the brain and liver. The brain is swollen, so you can't see the indentations very well. It's yellowish when cut open, and under ultraviolet light it can fluoresce. But the most common way to confirm a diagnosis of polio is you see a response in 24 hours after you start the vitamin B1 or thiamine injections. They might not recover fully, but you will get a response in 24 hours. So the treatment is vitamin B1, which is thiamine, 10 milligrams per kilogram, ideally intravenously by a vet, every 6 hours. Now, unfortunately, that means a prescription, because there is no vitamin B1 that's registered for goats, but it's easily found in produce stores because it's given to horses all the time. A veterinarian can also give drugs to reduce the brain swelling, for example, dexamethasone, diuretics, and hypertonic intravenous fluids. So that was the first disease, Polioencephalomalacia. The second one that I was asked to talk about is coccidiosis. Coccidiosis causes scarring, especially if there's a little bit of blood in it. But kids over 4 weeks of age can also get giardia. Once they start grazing a fair amount, they can get black scour worms. They can also get salmonellosis and yersiniosis. Enterotoxemia can cause scouring, but generally just causes sudden death. So the most likely cause of scouring in kids over 4 weeks is coccidiosis. Coccidia are single-cell parasites from the species, from the Emeria genus that live in the gut. They reproduce by asexual and then sexual reproduction in the gut. Gut damage can therefore happen before any of the oocysts, which are the equivalent of eggs, are produced because they're only produced by sexual reproduction. There are many different species, and it's impossible to tell these by just looking at a fecal sample. Some species produce a few oocysts, and some produce many oocysts, and some of these species are more dangerous than others. The good news is coccidia are species-specific. So coccidia in goats can only be caught from other goats, can't be caught from poultry, and even sheep have different coccidia species. But almost all goats have some coccidia oocysts in their feces. And the presence of coccidia oocysts, which is the eggs of this single-cell parasite, does not mean that the goat has coccidiosis, which is the disease caused by coccidia. A survey in Florida of 277 goats on 11 farms found 97% had oocysts in the feces. A similar result was found in Queensland. 74 to 90% of goats had coccidia oocysts. The presence of oocysts, and this is them just here, does not mean that the animal has the disease coccidiosis. Here's some other examples. You can see here a lot of these little tiny oocysts. They're a lot tinier, so here's some 3 worm eggs in the middle, and around the outside are the coccidiosis oocysts. So they're tinier than worm eggs, and they're generally round or oval. So the decision to treat or not depends on whether they have diarrhea or scours or normal faeces. So if the faeces are normal, don't treat, because the goats will develop an immunity to coccidiosis, to coccidia that are in their intestines. But if they have diarrhea or scours, then you do need to treat. Now, stress is often a trigger, and stress can be from being moved, transported, new home, weaning. These are all causes of stress and can also be caused by just general worms as well. It's generally a disease of kids, but occasionally if goats are very, very stressed, for example, when feral goats or rangeland goats are captured and put into a confined area, they may develop coccidiosis. But it's generally a disease of kids. So they're between 3 and 4 weeks of age or older. They have diarrhea, sometimes blood in the feces. They become pot-bellied, their coat is rough. They stop eating or drinking milk, and they become dehydrated. And this is a video showing dehydration, and this is the skin pinch test. So you can see in this goat that the skin is pinched up and it stays up for a long period of time. And this goat kid is very dehydrated. And you can see there I'm giving it some subcutaneous fluids after it was given some intravenous fluids. Now, this is a normal kid, showing the normal kid.
Along the back and rub
It
it
was
all over down the
anaesthetised foot
sides.
disbudding, just showing you the
How long does that last?
skin pinch
Lasts
test.
for
You
about
pick
2
up the
weeks
skin
and you do
and
it
it
again.
immediately drops back.
So tell me when.
I'm filming.
Oops, bounces right back. The other sign of dehydration is the eyes become sunken back into the skull. And that's because the eyes sit on a little fat ball, which has a lot of fluid in it. And when the goat becomes dehydrated, the eyes sink back into the skull. So the kids should be kept warm and make sure that the kids can drink water and that the troughs are not too high for the kids. All coccidiosis treatments require a vet's prescription because they're S4s and none of them are registered for goats. So you can treat with either sulfonamides, things such as Scouban, trimethoprim injections, Scourex oral. Acox is another treatment option. Amprolium, but that's only registered for poultry, and it's not one that I would recommend when there are other better drugs. Monensin is a preventative, and it's a feed additive. It must be added to pellets or mixes at the feed mill because it is quite toxic. Bacox, even though it's widely available, it's only registered for cattle and pigs. The Bayer used to have this fact sheet on their website, and that gives you the dose for goats, which is 20 milligrams per kilogram. But it's more important that you give supportive treatment. So that's intravenous or subcutaneous fluids. You can give oral electrolytes in between milk feeds if they're on bottles, if they're an orphan kid. Don't give thiamine if you're giving amprolium because that helps the coccidia survive, but do have it on hand because amprolium, as we learnt before, is one of the predisposing causes of polioencephalomalacia. And I put this article up because you can see here that goats that have coccidia can become deficient in vitamin B12. So you might like to consider some multivitamin Bs. This is the life cycle of the coccidia. And you can see here the asexual reproduction. And every time these young ones are released, a cell is destroyed. And you can have multiple numbers of these reproduction cycles and multiple cell destruction. And only at the end is there sexual reproduction and oocysts are passed in the feces. And those oocysts can last a long time in the environment. But coccidia damage the lining of the gut, and sometimes that damage is permanent. So on the left-hand side here, you can see the normal intestines, and they have these little papillae that project out into the middle of the lumen of the intestines, and that increases the surface area. And notice very healthy-looking cells. Here is the gut lining of a kid with coccidiosis. You can see that it has a lot of debris at the top. It's got a lot of dilated blood vessels and areas where blood is in these villi. And that blood can actually cause scarring, and that is going to permanently reduce the ability of that gut lining to absorb food. So fibre goats are generally raised by their does, If they're still sucking and keeping up with the dough, just note tag numbers and monitor them. If you don't think they're suckling, catch them and evaluate. Estimate their dehydration by doing the skin pinch test, looking at their eyes. Check they've got a sucking reflex by putting your finger in their mouth. Check their tummy is full. Give electrolytes, ideally with propionate, not bicarbonate, not citrate, so milk from their mothers will still clot. So you can give 100 mils per kilo split over 2 to 3 feedings or stomach tubing as a guide. If the kid is down and very dehydrated with an empty tummy and cold extremities, then you might need a vet to give intravenous fluids. Unfortunately, there is a global shortage of intravenous fluids, and vets are the last on the list after hospitals and doctors to get sterile intravenous fluids. And this is something that the Australian Veterinary Association is actively trying to stop, and so that vets can get access to intravenous fluids. Hopefully this will be resolved soon. If you have a prolonged kidding period, try and drift those does off with the older kids and get them away from those does that are yet to kid or have very young kids. So try and move them to a nearby paddock so that you don't have those kids contaminating the younger kids. Moving along now to iodine deficiency and goitre. This is a map. It's reasonably accurate. And the red dots are showing areas that are iodine deficient. But in wet years, such as we're having at the moment in the eastern states, you can get iodine deficiency showing up even in areas that haven't traditionally had it. Now, this is an extreme case of goitre, and don't look for these. This is just a very extreme case. But you will see some areas of swelling around the larynx. And you'll notice this kid also had its very short hair, not very good hair coat. You can dissect out the thyroid gland, which is just below the larynx, and you can see it just here. It's very tiny, and it needs to be less than 0.4 grams per kilogram of body weight. So weigh the kid, dissect out the thyroid glands and weigh them so that you know if the thyroids are enlarged or not. You can also measure their length and width, and the normals are given there. And also looking at the weight. And you can express that as a thyroid weight to body weight ratio, and it should be less than 0.5. If it's greater than 1.27, then you have enlarged thyroid glands. And this is from this reference. These were Angora kids, and this was unfortunately an embryo transfer program, which didn't go all that very well because they had iodine deficiency. So iodine deficiency can cause abortions. It can cause very tiny kids, can cause kids with very weak hair coats. And you can see here there's not quite enough hair. You'll notice that the thyroid weights to body weights were quite different. One here is almost normal, but all the rest, the thyroid to body weight condition ratio was a lot bigger. You can test the mothers. You can test blood or plasma for thyroid hormones. You can test the milk for iodine. And that is a way of telling if you've got iodine deficiency in the does. The treatment options for pregnant does, you can have a balanced mineral mix with iodine and using salt as an attractant. Goats have no ability to know that they're deficient in iodine and to seek out iodine. The other methods, you can use 300 mils of 7% tincture of iodine and pour that along the back line of the goat. Kids would get 1 mil if you find the kids and they're still alive. You can drench them with 28 grams of potassium iodine in 1 litre of distilled water, and 10 mils is the drench for each doe. And that's if you're seeing abortion in a flock. You should remove them from any goitrogenic pastures. So this means kale, leucaena, white clover, and couch grass. And if you're feeding linseed or soybean meal, you need to stop and have an alternate source of protein such as cottonseed meal. I'm always telling owners when I go to goat properties and I see these Himalayan salt blocks, I'm always telling them to get rid of them. These are pure salt, and that stops the goats from seeking out balanced mineral licks, because salt is what attracts them to the mineral mix or the mineral blocks. And if you're leaving pure salt out, then you'll be using that instead of the mineral mix. And the Himalayas have one of the worst percentage of goitres in people until they started a program to supplement pregnant women with iodine. You might not know, but all bread in Australia has to have iodine salt added, and that is to prevent goitres in those areas of Victoria, Tasmania, etc., when we know the soil and therefore the fruit and veggies are deficient in iodine. So if you see those Himalayan salt blocks, just get rid of them. What about seaweed meal? Seaweed meal is often promoted by non-vets. However, if you look at the analysis of the seaweed meal compared with iodine salt is 0.0190% iodine. And if you look here, you can see that the iodine on the seaweed meal is 0.5 to 1.2 grams per kilo. So that's a lot more iodine. And kelp and seaweed meal is a lot more palatable. But this leads to iodine toxicity. Remember, for most minerals, too much is just as bad as too little. For iodine toxicity, the clinical signs are loss of appetite and weight loss, watering eyes, coughing, dandruff, and it has caused goitre in foals, and it has caused conjunctivitis in dairy cattle. And so that's why I don't recommend seaweed meal or kelp meal. The other thing that you shouldn't confuse with goitre due to iodine deficiency is milk goitre. Milk goitre occurs in very well-grown kids, and all it is an enlarged thymus gland. Now, the thymus gland is generally down in the chest, but in some goats you can see it at the entrance to the chest here, and it goes up just around the larynx, and it is very, very prominent. But this only occurs in extremely well-grown kids, generally the males or single kids, and it's called a milk goitre. It's just that the thymus gland is just enlarged, and at this particular stage, around 2 months of age, it becomes very large and obvious, but it is quite normal, and it means that you have a very well-grown goat. Notice that this goat is well-grown and it has a nice hair coverage.